these latest cases, many in the community are asking, how do I keep my family safe? And how do I know if I've even been exposed to COVID-19? Our Catherine Garcia digs deeper into these questions.
With no given structure mandated by the federal government and in some cases the state government, each municipality in the U.S. is handling the COVID-19 pandemic differently, especially in terms of communicating with the public. For example, every day the Abilene-Taylor County Public Health District releases a graphic listing facets regarding testing and cases in Taylor County. However, one factor not released is tracing. Tracing involves an investigation in which a patient tells health officials where he or she has been in the past couple of weeks to then notify to others of possible exposure. Annette Lerma is the Director of Health for the Abilene-Taylor County Public Health District. She says each investigation is immensely thorough.
How many people were around you? What time did you go? Can you provide the receipt so we can be as accurate as we can with the whereabouts?
Health officials then notified those potentially exposed on an individual basis, not publicly. Lacey Nobles is the Public Information Officer for the City of Lubbock. She says the city's approach has changed over time, but while each jurisdiction faces different issues, her philosophy is for local government to share as much information as possible during the pandemic.
This is something that is going to ultimately affect every citizen of the community. Why not be as open as you can? It may cause some panic on some people, but also they can't tell you that you didn't inform them.
On Monday, Abilene City Manager Robert Hanna reiterating his initial response that he gave when the city confirmed its first case of COVID-19, justifying why tracing information is not released to the public.
I don't anticipate releasing community tracing information. I don't want to repeat some of the nonsense on social media that we've seen in this community recently.
Echoed Hannah's comments, saying there's no clear-cut answer to the effectiveness of informing the public on these investigations.
Is there validity to that? I don't know. I don't know the evidence behind that. But if we treat it as if every business can expose us, I think that's really the most important message that we can provide the community.
Lerma says following CDC guidelines, everyone should wear protective gear while away from home, but saying while every business has the potential to be exposed, it's simply up to every person to stay home.
Economically, it's going to be really hard if they have to close their doors, but don't you think it's better that they close their doors and risk their lives?
So again, I don't have any jurisdiction over that. I have to approach things from a public health standpoint. And I'm just going to say that if you have to go out and you have to conduct business, that your responsibility is to do everything you can to protect yourself and your family.
In Abilene, Catherine Garcia, KRBC, Abilene's local news.